Locating the iliacus and psoas muscles might feel foreign, but it's really quite simple. These muscles are easy to find, and your abdominal organs will gladly slide out of the way for you. The effect of releasing these two hip flexor muscles has profound effects on the entire body, so it's well worth the search. The iliacus spreads out like a fan, covering the inside surface of the front of your pelvis. It starts at the top ridge of your pelvic bone, and then its shape narrows to a tendon that attaches to your inner thigh. If you curve your hand and imagine it sinking into the front of your pelvis, you can imagine the location of your iliacus. When your iliacus is tight, it can pull the pelvis forward, compress your hip joint, irritate your groin, tug on your SI joint, and change the alignment of your entire leg and entire spine. And that's just the beginning. The mark was designed specifically to target and release the iliacus. It's that important. The psoas attaches at that same inner thigh location next to the iliacus. This may be why many people incorrectly think of the psoas and iliacus as the same muscle. The shape of your psoas is like a rod as it travels diagonally through your body from your inner thigh past your iliacus to finally attach to your lower back. When you release your psoas, you'll be targeting the front part of the muscle near your iliacus. The second half of your psoas is deep in your abdomen and too hard to reach from the front. When your psoas is tight, it can change the alignment of your core and it puts pressure on the lower back joints, discs, and nerves. Although they are different muscles with different jobs, you cannot expect the psoas to release if the iliacus is tight and vice versa. Let's make sure you can find both on your body. Tightness in both muscles can be anywhere along the length of the muscle. Although you may feel tightness or pain in the groin, where the iliacus and psoas attach, this area has nerves and blood vessels that are sensitive to pressure. A good rule of thumb is to avoid using the mark below the crease of your hip. You can find the crease by bending your hip and noting that diagonal line that is formed. If you would like to explore the muscle at or below this line, use the orbit, a ball that is the correct density and size for this area. With your fingertips above the hip crease, place your full hand right inside your pelvic bone. You're now covering the release zone for the mark. It's important to explore different locations in this release zone to find the spots that are tight for you today. Each day might be different. The ring and pinky finger side of your hand is closer to the bone. Using the mark in this area increases your chance of finding the iliacus. To target the iliacus most effectively, start with the mark near the bone with the platform flat. After the mark sinks into your body, press on the handle to rotate the tip into your iliacus. When you do this, the platform will tip up. If you're too close to the bone when you start, or if you're really tight to start, pressing on the handle may result in the tip flipping over the pelvic bone and out of the release zone. Remember, because the iliacus is all along the inside surface of the pelvis, you have a lot of area to explore. Experiment with different angles of the handle, always starting with the platform flat, letting the tip sink in, and then press down on the handle to reach the iliacus. With your hand on the release zone, your pointer and middle finger side of your hand are further from the bone. This is where you'll most likely find the psoas. To target the psoas most effectively, the mark would be positioned with the platform flat. Explore up and down the release zone with the platform flat to find the parts of the psoas that are waiting for a release. Mastering your release zone and how to find your iliacus and psoas is the first step to getting the most out of the mark.